COVID-19 hit India back in early 2020 and has since affected crores of people and claimed lakhs of lives. Since the time it struck the world, efforts had been on at a global level to create a vaccine against the deadly virus. Through the persistent and determined efforts of scientists all around the world, several vaccines to protect people against COVID-19 were successfully developed post careful trials and testing procedures. With this, it was time for countries to start vaccinating their citizens on a mass level to deal with the rising cases and deaths due to COVID-19 and protect the people. India jumped on the vaccine bandwagon with the launch of its first phase of the vaccination drive on 16 January 2021. This phase prioritized vaccinating healthcare workers and frontline workers as well as older people who are the most vulnerable to the virus. It included citizens above 60 years of age and eventually those above 45 years of age. Two vaccines, Covishield and Covaxin, were used to vaccinate these citizens, which had been granted emergency use authorization or accelerated approval by the national regulator. According to the Ministry of Health and Family Welfare, under the National COVID Vaccination Program, from 16 January to 30th April 2021, 100% of vaccine doses were procured by Government of India and provided free of cost to state governments. State governments were in turn to administer vaccination free of cost to defined priority groups. To increase the pace of vaccination, participation of private hospitals was also enlisted where individuals could choose to get vaccinated at a prescribed rate. The Health Ministry had aimed to inoculate 3 crore healthcare and frontline workers during the first phase of its vaccination drive. However, by the last week of April, the government was lagging way behind its target as only 37% of healthcare and frontline workers had been fully vaccinated. The overall pace of vaccination remained quite slow during the first phase due to a number of issues. Many officials said that the states were unable to effectively mobilize the priority population. Vaccine hesitancy was prevalent throughout the country despite intensive efforts by the Government of India to spread awareness and get rid of it. More significantly, many states faced vaccine shortages and state governments requested for permission to procure vaccines directly and administer them as per their own prioritization based on local requirements. In light of all these problems and requests, the government decided to revise its guidelines, which came into effect on 1st May 2021. According to the Ministry of Health and Family Welfare, under these new guidelines, Government of India was procuring 50% of the vaccine produced and was continuing to provide them to states free of cost for administering to priority groups. The state government and private hospitals were now also empowered to directly procure these vaccines from the remaining 50% vaccine pool. Starting on 1st May 2021, India also opened vaccination to all people above 18 years of age. However, problems still persisted because the supply was still constrained. Expanding the criteria despite this shortage created inequity, which meant that more people younger than 45 years received their first shot than those older than 60 years. States also complained of issues in the process of procurement, funding, and logistics of these vaccines. Thus, to deal with all these issues and move closer to achieving its targets, the Government of India launched a fresh vaccination policy, which came into effect on 21st June 2021. This time, the central government took the reins in its own hands to manage the procurement and funding of the vaccines due to problems faced by the states. As part of this new policy, the central government will procure 75% of vaccines produced by the country's manufacturers, which will directly go to states to be administered free of cost. The remaining 25% will continue to be procured and administered by the private sector. Under the new policy, all citizens above the age of 18 years will be vaccinated free of cost at state and central government facilities. At private hospitals, Covishield costs Rs 750, Covaxin costs Rs 1410 and Sputnik V costs Rs 1145. These charges also include a service charge of Rs 150. States will receive vaccinations as per their population, progress and wastage of vaccination. Also, in order to help the economically weaker sections get vaccinated at private hospitals, RBI recently launched e-vouchers called e-rupee, which we discussed in our last video. The Government of India has set 31st December 2021 as its target to vaccinate India's entire adult population. It will be very difficult to achieve this target at the current pace of vaccination, which is why India needs to ramp up its vaccination drive significantly. Factors such as increase in vaccine supply, along with efficient and smooth administration of vaccines and coordination between the center and the states, will play a key role in determining the success of India's vaccination policy and the subsequent achievement of its target. Have you got yourself vaccinated against COVID-19 yet? If not, register on the CoWIN app and schedule your vaccination right away.